Hey, good morning, friends. Good morning, Colorado. Hope that you are doing well. Aaron Johnson coming to you live from Castle Rock, and want to have a conversation today in a little bit different format than I normally do, and a little bit different opening than I normally do for my segments, because today's conversation, well, to be frank, it's a little bit awkward for me to talk about, and awkward for a lot of people to talk about, but nonetheless a conversation that I think is really important for us to have. And what I'm getting at is that September is Suicide Awareness and Prevention Month, and this is a conversation that is important for us to pause, take a few moments to discuss and understand what's going on around our community, and to talk to somebody who's serving on the front lines in our community. And uh, my guest today is the coroner for Douglas County, where I live, and her name is Jill Romann. And as I've created this channel, and my goal is to talk with people who I say are elevating our community, who are doing the hard work in serving our community. And Jill came to mind very quickly for me as somebody that I wanted to talk with. And fortunately, to be able to have her come on here this month is great. And um, her and her team are on the front lines when tragedy strikes in our community, and somebody unfortunately takes their life. And so the conversation that I want to have with her is to talk through, get an understanding from her eyes, from her perspective, what they're doing to serve the community and try to help save lives. I don't know if we have all the answers today. I don't think that we do. Again, this is an awkward conversation for me to have. I don't know all the questions to ask, but nonetheless, something that I think is worth doing at this time to try to help create some awareness and understanding around this very serious issue of suicide. And so I'm not going to do my normal opening, and I think this is a topic that deserves more respect and less show. And so for that, I'm just going to bring Jill straight on here and introduce her and have her talk about what they're doing in the community. So with that, let me bring on Jill Romann, the coroner in Douglas County. Good morning. How are you?
Well, good morning, my
Yes,
friend. Hi,
thank you.
Aaron. Thank you for inviting me on. It's quite a privilege.
Well,
Thank you.
I appreciate it. So I heard you speak. It was probably a few years ago now at a community event, and I never heard somebody in your position speak before and give an understanding of what's going on in the community. And I shouldn't have been surprised, but I was, and I was impressed that suicide prevention is a priority for you. Of course it is, but I just hadn't been in that mindset yet, because I guess so many people see the coroner. Our exposure is the person that's on TV, as like a crime drama or something like that, and you see him walk in the background, or on the news when a tragedy is struck, and you may be speaking during a news conference. But ever since then, I've thought about what you said and wanted to have a deeper conversation about what you're doing in the community, get an idea from what you and your team are doing, and from your perspective. So with that said, let
Yeah.
me just open it up to you. If you can just share a little bit about yourself, and kind of what you and your team do on a daily basis.
Well, first, I want to explain that I like the word, instead of the phrase suicide prevention, I
Mm-hmm.
like the phrase suicide understanding. So let me first tell you about my staff. Coroner means elected, medical examiner means appointed, CV resume. Your Douglas County Coroner's Office is an elected position. We can either be physicians or non physicians. I hire board certified medical or board certified forensic pathologists to actually do the autopsy. But who really makes these decisions are the medical legal death investigators who are on the front lines. You've heard the term CSI here at Douglas County. Um, the phrase or the term MDI, the acronym MDI is used. So my staff is made up of MDIs. We have the highest number of certifications
And what's an
with
MDI stand for?
medical legal death investigator. So in
Okay,
medicine,
thank
when
you.
you combine two organs or two systems or two concepts, you combine them with the letter O. Medic, O, legal, medical legal
Okay,
death investigators.
thank you.
That's who we are. I'm an elected official that hires a physician or physicians who specializes in injury and disease documentation. And then I have a staff of investigators that go into families' homes, work with these families
Mm.
hand in hand at a psychological, at a criminal, and most importantly, at a medical standpoint. Law enforcement joins in on these investigations,
Of
obviously,
course.
because they're the experts in criminal. We're the experts in public health and in medicine. And to that end, we get a very difficult job done, and I'm very proud of this staff. They're pretty amazing.
I'm
So,
sure.
yeah,
It's a
thanks.
unique work, and it takes a unique person to do it. And the service that you all provide our community is critically important. So thank you to you and your team
You're
for
welcome.
that.
So,
Yeah,
yeah,
you and your team are on the front lines, as I say,
yeah,
when tragedy strikes. And I guess I before hearing from you, didn't appreciate just how much you work with the families and just trying to console them as well. So that's obviously
yeah.
now a critical part of your job. So I guess stepping back a little bit, uh, what are the trends around our community or the state um, in this area in suicide? And um, you know, it's, it's let's get a foundation of what we're talking about and the seriousness of this when it comes to how frequently this happens. Are the trends going in a positive direction? Are they going in a negative direction? What is your team seeing?
Well, to take a look at trends, you have to first talk about the contagion effect.
Mm,
The contagion effect has been proven to be a major driver in any community. When we have one teen suicide, now I'm not going to give you exact numbers. Listeners, please understand there's a lot of variance in every community, but I've been doing this work since approximately 1987. So I can speak from experience, but not every state is the exact same. But nationwide, clearly the contagion effect is there is a huge impact. Certainly nobody wants to lessen this to a simple, very derogatory phrase of monkey see, monkey do. But in way of an explanation as to what I mean, that's exactly
okay.
what I mean. Suicide begets suicide.
Mm,
And when Robin Williams took his
mm,
life, not did suicide beget suicide, but in the exact same manner at a percentage increase as to how Robin Williams did it. When other Hollywood people took their life, we saw a nationwide spike in suicide, but not just in suicide in the exact manner that Kurt Cobain took his
mm,
life.
mm-hmm.
So it is a very real, very proven issue, and it has been borne out statistically nationwide. That statistic can exist in all communities, and Douglas County is no exception from that. If we have a teenager commit suicide in a high school, we are more likely to have another teenager in that same high school commit suicide.
Mm,
If we have an uncle who committed suicide, even a generation or two generations apart from the reactive 27-year-old with attention disorder and severe depression, he is more likely or she is more likely to commit suicide. It is an absolute fact that white Americans commit suicide at a much higher rate
Wow.
than African Americans, not because white or Northern European Americans have more stress or more this or more that. It's part of this contagion effect
Hmm.
that lives in subsets all across our world, Europe, Africa, you name it, the contagion effect. So that is a real focus, is to work with these groups and contagion effect. It's a real focus to ask somebody, have there been other suicides in your family? Who have you had
Hmm.
other friends who have committed suicide? This is an auditing question relative to people wanting to know how close, what is the highest probability this particular individual I'm working with. I'm a non-clinician relative to suicide, um, to what, in terms of prevention. I'm not a clinician. I tried to support the clinicians out there in 20, I don't have my dates exact, Aaron, so listeners, please forgive me, but I think it was 2015, if not 2016, I was on a suicide uh, prevention board with clinicians sitting there, and I said, hey, as your coroner, these are the questions I asked,
Hmm.
but I need to know what questions you want me to ask. I am not up front, I am behind. And so I took this to this group. We worked out a form. CDPHE, specifically Sarah Brummett and her team of Toward Zero Suicides with CDPHE, took up the call. And we now have this phenomenal form that we are pushing out to corners across the street saying, from a clinician's viewpoint, we are asking their questions
Hmm.
for them so that we can see what else besides the contagion effect do we need to be paying
And
attention
try to
to.
get some uniform data across the
Try to
state.
get some uniform data.
Yep.
There's another data gathering place, which is the violent death reporting system, and but that it doesn't ask the questions from a clinician standpoint. It just gathers data that uh, was asked in general terms. But it's a tool, so we're all after it, and your corners are very definitely after trying to help some of this stuff.
Okay. So you talked
So
you talked a little bit about race as far as the trends. Are there any other demographics that maybe I don't want to say susceptible, but impacted by this more? I would imagine males are more so in that category, but I don't know, like age, region, rural versus urban, suburban, uh, anything like that that you can share?
well, it has to do with the ways in which they take themselves often. The
Okay.
urban areas, if they're going to use a weapon, they'll use a handgun.
Mm.
In the rural areas, if they're going to use a weapon, generally they're using their hunting rifle,
Mm.
right? So there are some differences in that.
Okay.
So year to date in Douglas County, we've had 38 suicides. 32 are uh, males.
Okay.
6 so far this year are females. And the age categories are mixed a little bit. The age categories are, let me just bring it up for you. In the age group of 10 to 19 year olds, I've had 3. 20,
Mm.
20 to 29 year olds, Douglas County has lost 5 individuals. And we've had in the 30 to 39, 7, 40 to 49, 6, 50 to 59, 1, 60 to 69 is 4, 70 to 79 are our oldest individual that committed suicide so far this year was 7, or excuse me, 5 so far this year. This is lower than usual. When COVID started
Mm-hmm.
in 2020, politicians really promoted the concept, and I'm not telling you they were wrong. We were all scared. We didn't know what was really going to happen, but they really promoted this um, upset that by closing businesses and doing all this kind of stuff, we were going to have suicides left and right. And this was a huge promotion in terms of the businesses. Well, that didn't prove to be true
Interesting.
at
Okay.
all. And in fact, in 2019, my suicide, not mine, the county suicide rate was 55. In 2020, it dropped to 52.
Hmm.
And here we are, even lower. Now our year's not over, but
Mm-hmm.
even lower, we're at 32. With COVID, I cannot speak as an expert, but I can tell you the fear did not prove out. The public health orders did not push people into suicide. Now we're not over COVID.
Sure.
We don't know where it's going to go, but families, there were divorce courts were closed, things like that. So maybe that had something to do with it. Not completely closed, but there was some delay while everybody was working this out. So we were afraid,
Yeah.
but it didn't prove to be true.
I guess that's good news. I would have
But
anticipated the opposite, and we, there's so much
next,
stress that I think people are feeling over the last 2 years. And if you just look at trends of people's opinions, and trends like do you feel like the country is going in the right direction, or do you like what's going on, and so forth. And people are pessimistic, uh, and of course the economy is struggling, and so I think that those are all indicators of the stress that people are going through. But it's heartening to hear, I guess, that the numbers have not spiked or not increased as a result during the last year and a half, 2 years, as we've been going through COVID. So um,
and that's
that's good.
nationwide.
Mm,
That's not just Douglas County. That is
mm-hmm.
statewide.
Cool.
That is nationwide.
Okay. So I guess a little bit about for people that I would like to know what advice you have, or what programs we could help point people to, that if they're starting to slip down a path, and they feel like that they need help. What is it that your office recommends? Is there a program that you guys partner with for people, as you talk about this around the community, that you point people to?
Well, the first thing that I say to everybody is no person is immune from
Mm,
suicide. I don't care if you're a public figure or if you're strong, how educated or lack of educated are. There is not one circumstance that will push a person into suicide. Nobody knows you better than the person that loves you most. That person that loves you most is the first defense.
mm,
Everybody has to have permission to say, I see you're down. I'm going to be very straightforward. Have you had any ruminating thoughts about suicide? I can see you ruminating nonstop about your school grades. I can
mm,
see you ruminating, keep bringing it up, bringing it up, bringing it up about your boyfriend. I can see that you're ruminating about how far in debt you are. Rumination is a huge component to chronic severe depression. And what happens with that is you might have a world this big, but rumination brings it down to a world this big.
sure.
And now you're going down that suicide funnel.
Mm,
So the first defense is the people that love you most. Ask those questions and be educated as to what depression is. It is a blocking out of every other particular thought that you have. When you funnel down through rumination to one particular area, you're in trouble. We have here at Douglas County a most remarkable woman. Her name is Barbara Drake. Barbara Drake is assistant county manager.
Mm.
Barbara Drake also uh, has a love for humanity and working really hard. And Barbara Drake started a program in Douglas County, the Crisis Response Team. I believe we can possibly credit, not all the data's in, our lowered suicide rate to this crisis response team. Part of that crisis response team, people show up the door, they say, it's okay. We are not going to immediately take you to the hospital. We're not going to disrupt your life. We are going to softly talk to you about what we can do to help.
Okay.
We don't have a strong law enforcement component with that. We have a law enforcement component to protect them and the responders. It's not a flashy situation, it's a personal situation.
Okay.
And I think that uh, the crisis response team through the 911 system here in Douglas County is a remarkable safeguard started by a loving individual who has done wonders for this community. The other things that are happening is
Mm.
that, uh, for example, Douglas County Rotary Club is looking at mental health in the schools.
Mm.
We have the Douglas County Mental Health Initiative that is working really hard, and they're drawing all of these organizations together and they're looking for gaps in care. They're also asking everyone in Douglas County is empowering citizens to step forward. Suicide is a community response beyond the family, and I think Douglas County is doing real well. It is not solved. It's an elusive kind of beast, but
Mm.
I'm proud of what Douglas County is offering. First call for help, crisis line. Ask your loved one the very difficult question. I don't care how old they are. I don't care if you're justified in thinking that they're right and constantly ruminating or hating this person. The fact that they're constantly talking about this person. If somebody self secludes, figure out why they're doing it. Be brave. Remove guns. Be brave. Ask these questions. And I think it's every citizen's responsibility to do it, and we're doing it.
Okay. And as I talked with people and asked some friends yesterday, like what are some questions you can ask for this? What would you like asked? One friend spoke up and said that I guess is there any advice for somebody who feels like there's this conundrum between wanting to ask for help and feeling a need to ask for help, but also uh, on the contrary, feeling like if they ask for help, that they're increasing the burden and they don't want to be a burden to a loved one or to their friends. And so if somebody's feeling like they're in that trap, is there any advice that you could probably, I mean, is it contact the CRT that you mentioned, the critical response team? Sorry, I forgot.
That's all right. So, Aaron, if I'm understanding your question,
Mm-hmm.
if I'm depressed,
Mm-hmm.
all right, what should I do to
Yeah.
help myself? Or first of all, the reason this is such a silent killer is people don't realize they're depressed. People often have to be told they're
Hmm.
depressed. People often have to, when you're ruminating because of a circumstance around you. And the definition is focus on that circumstance instead of focusing on the fact that you're really ruminating, and which over and over and over, and you draw everything into that. If but for my husband, but for my wife, but for my boss, but for my wife, all of this, right? You have to be told you're doing that. If you suspect you're doing that, you need to ask someone.
Hmm.
You ask a professional, do you think I'm depressed? Do you think I am engaging in mental illness? That's the bravery component, is that don't leave this to your own thoughts. Get out there and find somebody, ask them what they think
Okay.
about what's happening to you, because you don't want to be doing this and you wouldn't be doing it, but you're not recognizing what's happening to you. You can have a million people talking to you, and I don't want this to be an obscene comparison. Please,
Please.
everyone, forgive me for this comparison. But if you have an extraordinarily full bladder and a million people are talking to you, but all you can feel is that extraordinarily full bladder, right? You're not hearing these other people. And that's depression. You don't hear them. And so you don't realize what people are saying or not even saying to you. You have to recognize that you're not hearing people and that you're going down this dark hole. So ask other people. Usually people feel most comfortable asking a stranger or a psychiatrist or a psychologist. Please get help. Step out. You did not ask to be depressed.
Hmm.
You didn't. This is
That's a good
not
point.
your fault. This is illness like anything else. It was brought upon, it can be brought upon by hormones, it can be brought about by internal chemistry. We don't have a good handle on what cures depression or how it actually comes to us. Don't take this on as if there's a failure. This is not a failure to live a full, beautiful life. This is a medical issue. If somebody says to you, I think you're depressed, act on it
Hmm.
because they've taken a risk. Now you should take the same risk because there's nobody that's going to be better to yourself than you are. Just recognize it and move forward. Hear what people are saying and get help. And help doesn't always come in pill form. It always doesn't come from psychologist or psychiatrist. It doesn't always come from your spouse. Your own help is unique. Be brave and figure out what your own help really means to you. And try everything, try anything. Stay the course. Be persistent because you're worth it.
Okay. Thank you.
You're
And
welcome.
so you mentioned about COVID and what we've seen over the last year and a half. Another significant thing is with just digital technology and social media, and particularly as a parent, something my wife and I have discussions of when do we give our kids digital devices? What do we allow them to have access to? What is a age appropriate time for that? I mean, these are all the discussions that we've got to have nowadays that I didn't have when I was growing up. So I guess is there insight that you can provide around what your office is seeing, your team is seeing, around exposure to social media and these devices here and the impacts that has on mental illness and driving some of these young cases that you mentioned earlier, people under 20, people that are in their 20s, to take their own lives. Is there advice that you have for parents, or even those young people?
Social media is a huge pendulum swing on both sides. But I was just saying to one of my best friends yesterday, I have a grandson who
Mm-hmm.
is not sure where he lives in life. Is he living in a male body but is really female? He's a young guy. Uh, he's just not quite sure
Sure.
where he fits yet. And there's not a lot of solid discussion that he's going to tell his grandmother. But what I remarked to my best friend yesterday is I am so pleased because he's not being bullied.
Mm-hmm.
He's not really being bullied on social media. And I am seeing with the campaigns that are out there that there is less bullying on some of these topics. I'm seeing social media doing what we hope it would do. I am
Interesting.
seeing people, it used to be only about a third of people leave letters of intent, aka suicide letters. Only about
Okay.
a third.
Wow.
We don't see those too much in handwritten form anymore. But when somebody hints at that, or actually writes a letter of intent or hints at it on social media, lives are saved.
Hmm.
And they're saved really fast. You would be amazed at if somebody is so desperate that they actually are looking to help to the point they put it on social media, how fast people are reacting to that. Within minutes,
Wow.
people that have seen their friend put something on social media react, call 911, CRT is dispatched. Social media is saving lives. And I can't tell you how many lives it saves because I am on the other side of things. But I
Sure.
can tell you that when we don't get there fast enough, the initial call was still made because somebody posted something on social media. And I don't think social media is all bad. I have a tough time with it. I get crucified on social media on occasion. I'm good with that because I have my opinions and this is America and I believe what I believe. But it's not all bad. I think we, as my generations, I'm 65 in a couple of weeks, we were very concerned. We were very worried. Just like I said earlier, everybody was very terrified. We're going to have a huge amount of suicides because of COVID and
Mm-hmm.
businesses shut down.
Mm-hmm.
We're playing out to be true Americans with good hearts and good intentions. And because the venue's changing, I don't think we should be really afraid of it. I think obviously I can be very naive and there's a lot of subversive stuff that happens, but the bullying campaigns are working, at least in my personal life. What the schools are doing is remarkable. We need to continue this drive to be wary, to look ahead, to try new things. But I think some of these things we're trying are working. And as a parent, I want to tell you, as parents, me as a grandmother, when I started in 87, I had dead infants underneath water beds. I had dead infants in rivers. I had drug overdoses of 18, 19, 20 years old. We've gone through this huge opioid crisis. Let me tell you, when my students are in the office, I praise them.
Hmm.
The students always need to be monitored, always needed to be shadowed by a responsible adult with a love for what they're doing. But I'm proud of our students. I'm proud of the fact that that they are not the risk takers the generations before them were. When I have a motor vehicle crash, it's because nobody could survive. It's not always because he wasn't seat belted,
Hmm.
because most of them are seat belted. And the youth of today are, I'm proud of who they are. And I think that is true with how they're using social media in general. As long as we continue to educate them, and that is the key piece. And I think Douglas County schools are doing a remarkable job.
Thank
So
you.
we're
Yeah.
always always room for creativity, education, insight, and
Of
wisdom.
course. Yeah. Of
Yeah,
course.
right.
Well, that's good to hear, I guess, in a way, because so much of the news is negative, and of course, the news does tend to focus more on the negative. It has a negative bias. And I had walked into a restaurant a week or so back and was picking up food to take out, and it was Friday night, and take some food home, and I just glanced up at the TV as I was walking out the door, and it was a negative story about
Oh,
social media and depression in kids, and so that's typically, I guess, the meme that we hear. but I appreciate your perspective and that there is some positive news and it's not all bad and there's some good things going on. And I know with Facebook, there's a lot of criticism that can be directed Facebook's way, uh, but they have focused particularly on uh, awareness and trying to help people. There's so much that they've done on focusing around COVID recently. I don't know if maybe that's waned some, but I guess there's some good news to see that there are results, positive results around that. I don't know what the other social channels are doing around that, but Facebook comes to mind, so that's good news. And then
Yeah.
yeah, of course, with the schools and everything the teachers are doing and trying to be present in their students' lives. And we know here in Douglas County that teachers are very passionate about pouring themselves into the lives of the students in their classroom and being present for them. And I think that's part of what makes this community so great. So that's good to hear. Okay, so I want to shift gears just a little bit and ask about you and how you got into this role. Maybe your education, some of your work background. Like, how does one become coroner? You're an elected official, which I would love to know as well. Why elected rather than appointed? But maybe that's a separate question. So let's start. How did you get into this role?
Well, okay, so I didn't, at 2 years old, I didn't stand up and say, oh, me, I want to work with the dad, please. How do I do that?
Nobody does
It,
that.
yeah, it was kind of something. I was in college and I was a late bloomer in college. I didn't get the opportunity, and there's no reason you have to know why, but I didn't
Sure.
get the opportunity to start college till I was 27. And I had
Yeah.
children by then. And I found myself, as to be a single parent, I needed to support my kids at a level that they deserved. And I got into the University of Minnesota, and I fell in
Mm.
love with microbiology. I fell in love. I couldn't believe a cell structure. I was absolutely amazed by what I was learning. I was so excited about it. And I knew I
Mm.
wanted to go into medicine, and it didn't take too much thought to be able to get there because, I mean, I actually was going home and plowing through anatomy books and the like. And I dedicated my life to studying my children. And because of that, when you have that real narrow focus, you end up being a very good student.
Sure.
And people
Yeah.
came to me and said, you need to go on to medical school. Well, quickly that dream died. It's an impossibility with 3 kids as a single parent and working full time to try to pull that off. So I looked around and got a degree in the University of Minnesota School of Mortuary Science
Okay.
because at the time, given my age, funeral directors weren't hiring women, but women was a quota issue, and I needed a job, and I was no dummy. And I took that route to secure myself a position in the community working. And because I love people, I love working with people, and I have every idea to go on to pre med and figure out from where. So that was my stepping stone, which led me to Hennepin County Medical Examiner's Office as
Mm.
a medical legal death investigator. And that started all the way back in 1987. Never really worked as a funeral director. That wasn't really too much of my drive, but it opened up the door for the medical examiner's coroner's office. And when I got into that, I realized that life is about connections
Mm-hmm.
and life is about working with families. And because of that, I might not have been the best criminal investigator. I certainly wasn't the physician that understood the difference between chronic kidney disease stage 2 versus chronic kidney disease stage 3. But boy, I had a real knack for families. And because of that real understanding, that deep understanding with families, I quickly rose. And I ended up being part of a supervisory team at Hennepin County Medical Examiner's Office, which is an organization of 1.2 million people
Yeah.
and,
Okay.
or citizenship. And then I was hired and I managed a county, a consortium of counties, a regional system of 8 counties. Uh, the population there is about 850,000, and I was a senior investigator there. And because of a building project, that organization kind of diversified into Mayo Clinic Rochester, back to Hennepin County, and another large agency. And I came to Colorado. And in Colorado, you have to run for the office. And I ran for the office, and nobody was surprised more than I was. The night I was told I ran, I won. And I've been your coroner ever since. So outside of that, I've been previously involved. I owned my own personal home. I brought in inner city street kids because I didn't like them on the street. And
Sure.
hardcore vice lords, Crips, Bloods. I've had two of my inner city street people over the age of 17 to about 25. Two of them have been murdered. I mean, hardcore people. I've just always been out there trying to do my best for my community with my three kids. And so anyway, so here I'm at Douglas County, and I couldn't be happier. I have about 15 months left,
Okay.
and um, and that's where we're at.
Okay. And
Yeah.
why is the coroner an elected position in Colorado? That's not necessarily the case in other states, as you're describing in
No,
Minnesota. So, is that unique in Colorado, and why is this the case?
you know what? When I first came here, I came from at the time it was a regional system, and even as large as Minneapolis, St. Paul is, they
Mm-hmm.
were a single jurisdiction, county jurisdiction. And I came here and I thought, and everybody up there was a medical examiner system, as is many other states. We're not unique, but I question it myself. Why is this elective? Because the basic understanding is here, you have to be 18 years old. That's it. And you can't have a felony. Well, that's a pretty low bar to walk over to become the coroner. But citizens are smart, I learned. Citizens, especially with social media, another great advantage of social media is that they're going to read everything about you. They're going to find
Mm-hmm.
out where you're not telling the truth or you are telling the truth. They're going to read your bio and stuff. Citizens are smart enough to get past that real low threshold. But still, even though now you can be fully vetted by the citizens and we get better candidates because of the day and age, digital day and age, why is it elected? Well, I learned it didn't take very long. I can't be pushed around. And that's important. I can't have the assessor, the commissioners, the treasurer push me around. I can't have DA push me around. Nobody can really push me around. And if you don't like what I have to say, for example, about masking, then vote me out of office.
I
And
see.
that
Okay.
is a solid American ideal. And that's what we want. It's a system of checks and balances. And even though it didn't make good sense because I do the same job if I'm a Democrat, the same job if I'm a Republican, the same job uh, no matter what the circumstance, because I have to follow the statutes. If I don't follow the ideals, I can be sent out of office. And that's a very good thing. So I uphold it. I definitely uphold it. And I think it's the right thing to do. You have to have experience in this office. This is not a child's game.
Mm-mm.
This isn't a fluke. This isn't something that anybody should just say, oh, that sounds cool. I think I'm going to run for coroner. That is a gross misunderstanding of what this office means to people. The other day, my staff got a large bouquet of flowers. And as we do all the
Wow.
time here, we get thank yous, personal thank yous, all the time. If I was to look back at I probably have 1,000 thank you notes
Mm.
and handwritten, not just off the cuff. And my investigators have hundreds of thank you notes. And that takes passion, that takes dedication. And I think you can vet that pretty well anymore, given our digital age. But it needs to stay elected. It needs to stay elected. You need to hold people responsibility for who they hired as that position to do the autopsies. You need to hold that person accountable for how their medical legal death investigators are behaving. Certainly, we understand why the sheriff's position is elected instead of appointed. This is just as critical.
Okay. Yeah, that independence that you have is important. Oh,
Yeah.
good. Okay, I think that is a great way to look at it. Um, okay, so before we close out here, is there anything else that you want people to know when it comes to, as you say, not just suicide prevention, suicide awareness? Is there one thing that you want people to walk away with?
You're all heroes. Americans are heroes. I'm not Pollyanna. You don't give yourself enough credit. You have no idea what you can give to somebody else's life. We are humans dedicated to serving humans. It doesn't take an elected official. It doesn't take an expert. It doesn't take a psychiatrist, a psychologist. It doesn't take the local doctor. It takes you. Be brave. Say, ask those questions. If somehow you lose a family member to suicide, if somehow, tragically, you lose your neighbor, it is not because you didn't say anything. You don't have to absolutely feel guilty for it. Just know that if the time is right, if the opportunity is there, all of the professionals give you uh, blessings to speak up. It doesn't have to be your responsibility, but you don't need our permission. Just do it. And thank you for loving your family and your neighbors and hoping to reduce this rate.
Amen to that. Thank you. So,
Uh, yes,
where where can people find out more about your team, about you, and the work that you all are doing online?
hey,
Let's say.
everybody, you own my building, all right? You're taxpayers. You don't need an invitation to stop by your local coroner's office. You don't need that. We're here 24/7 after 5
Wow.
o'clock at night. We could be out as first responders, so you might want to call in advance. But you can knock on this door anytime you want. We are redoing the website. All of Douglas County is redoing the website. I don't think our current website is up to standards that it should be. So I hate to say that is the face of your coroner's office, but you can go there. Hopefully you'll see a prettier face in the next couple of months because we're working hard at redoing that. You can call me with questions. You can call me with concerns. We're available. We're here to serve you. And if you're looking for ways to fundraise, if you're looking for anything,
Mm.
think of your coroner's office. We will help you be able to do that and in the shape and form you'd like to do it. So we're reachable. We're out there, and we are owned by you, not the reverse. So come get it.
That's what from an elected official there. You got it. So the website douglas.co.us and the coroner's page is on there, as well
Yeah.
as other resources, as you mentioned, the critical response team that you mentioned earlier as well, that are doing good work and helping people, meeting them in their homes to connect with them. So Jill Romann, thank you very much. Thank you to your team as well.
Yeah.
We don't get to see you guys a lot around, but the work that you're doing in serving our community, you guys are on the front lines. You don't always get the recognition and credit that you deserve, but you're doing great work and helping. Just with there's the law enforcement side, but the examiner side, but as you discussed as well, trying to help families as well, which is something that's very important for you, as you've shared, and trying to find some understanding in their moments of heartbreak and trying to understand what is going on. So thank you very much, Jill, for
Be
that.
safe out there, Aaron. Be safe out there.
Thank you. I will. I will let you go here. I'm going to talk for just a moment and wrap up. And I look forward to connecting with you here in the very near future as well. So,
God bless.
all
Bye
right.
bye.
Thank you. All right, folks. Thank you to Coroner Jill Romann here from Douglas County and sharing her insights. And again, just getting a perspective from the work that her and her team are doing on the ground in the front lines of our community as they are there with families in their moments of crisis. And you know, as she talked about, it's not suicide prevention, but suicide awareness, and trying to help provide resources that she can and her team can, so you know they don't have to meet those families in those moments. If you need help, if you're in Douglas County, contact her office, contact the critical response team that is here as well that she mentioned, and seek help. Ask family, ask friends questions, speak up, just reach out to them, and you know, get past that awkward moment and have those conversations. And if you need help, seek that out. They have resources there. I don't have the answers, and which is part of why, you know, as I started out with this conversation, I don't have the answers, but I know there's a lot of resources available. But this is a conversation that I've wanted to have to get an understanding from their perspective, from the coroner's office perspective, of what they encounter and what they're seeing in our community. So, thank you for taking time to watch through this, and have some more episodes coming up to spotlight more people who are serving in our community around Colorado, people who help elevate Colorado. So stay tuned. Look forward to bringing you more here in the coming weeks as well. And friends, again, thank you. And that is what is good in Colorado.